Hi, everyone, again. We're here. Mini lecture 8. You guys are doing an amazing job. You're in the home stretch. You have one more simulation, one more care plan, and then you're on your way. So good work. All right. This lecture is about our oh, sorry, I gotta move the screen. So we're gonna talk about post-operative complications here in this simulation. So, what is happening and why does it matter? The immediate post op period carries risk from anesthesia, risk from opioids, maybe some bleeding, immobility. Subtle changes, especially in breathing, can signal a developing complication. So, why does it matter for nursing? We need to do systemic assessments. What is a systemic assessment? It's something you guys have done all semester long. It's something that you even did in fundamentals. It's your head to toe. You need to make sure that you are always assessing truly from head to toe. A systemic assessment catches problems before they escalate. Recognizing an opioid induced respiratory depression and the danger of a PCA misuse protects the patient. What is a PCA? It's a pain control pump. You want to make sure that the patients are using it appropriately and it's programmed appropriately. So, our key concepts to review here are a systemic post op head to toe concept. We want to make sure that we focus on airway, bleeding, pain, infection, and DVT risk. For our priority, we want to recognize respiratory depression and sedation early. Breathing changes come before the numbers crash, so make sure you watch that work of breathing. Interventions are going to be stimulation, maybe that good sternal rub, oxygen, holding, sedating therapy, and VTE prevention measures. Pharmacology for this case is going to be the concept of safe PCA use, opioid reversal, and its shorter duration and anticoagulant technique. So, how our concepts are going to connect surgery plus opioids are going to have sedation and respiratory depression risks. You get medicine to make you sleepy, you're already sedated, and then you get pain medicine to help combat the pain that you're going to wake up with. You give respiratory depression medication to a patient that's already sleepy, it's going to be a real problem. I had that situation when I was post-op. I'm super med intolerant. A little goes a long way for me. I'm very much a cheap date when it comes to medications and pain medications, and I got a little bit of pain medication post-op, and I really was I was not breathing, so I had to get that post-op sternal rub, and the nurse had to sit with me and make sure that I stayed awake until the medication started to wear off a little bit. Assessment. You want to use a systemic type of an assessment, so that head to toe, and then you want to trend your assessments to find any subtle changes. Then you want to recognize as breathing slows, the numbers might stay the same, and then all of a sudden they're going to drop. And then safety. Only the patient presses the PCA button, no one else. Nursing reminders. Falling respiratory rate is an early urgent sign. Only the patient presses the PCA button, never a family member. Opioid reversal wears off sooner than the opioids, so keep monitoring. We can have that rebound overdose. And then post-op assessment is only protective when it's systemic and repeated. So make sure you continue to do your assessments. All right. It's your last simulation. You've worked hard today. You're going to kill it, and then you're going to rest when you get home. Okay. So I hope you enjoyed today, and I hope you learned a lot.